Hello and welcome back to Curry Soup. Today we are going to be talking about Alzheimer's disease. I'm sure a lot of you have heard of Alzheimer's disease and a lot of you know what Alzheimer's disease is. So for those of you who already know, this is sort of like a refresher course, something just to jog back the memories. And those of you who don't know what Alzheimer's is, today we're going to be learning everything we need to know about what Alzheimer's is, what are the treatments for Alzheimer's, and what can we do to prevent Alzheimer's disease. So without wasting any more time, let's get straight into it. Alzheimer's is a type of dementia. Dementia is the general term we use for memory loss and other cognitive ability loss which is serious enough to affect one's daily life. And Alzheimer's is a type of dementia that affects our memory, thinking, and behavior. Almost 60 to 80% of all dementia cases are Alzheimer's. Alzheimer's being the most common form of dementia. Alzheimer's is not something normal, it's not part of growing old. Although increasing age is a risk factor for Alzheimer's, and the benchmark here is 65 years old. So the older you are, the higher your risk of getting Alzheimer, but not necessarily you will get Alzheimer. But there are those who are younger than 65 years old and they still do get Alzheimer's. This is called early onset Alzheimer. And Alzheimer's disease is a progressive disease. That means once the damage is done, the damage is done. We do not yet have the technology or the information needed to reverse these damages. So over time, Alzheimer's disease will gradually keep getting worse. Initially, at the early stages, the symptoms may be very mild, very easy to be overlooked, like very mild memory loss. They forgot where they kept the key, where they kept their glasses. But over time, as the disease progresses and the symptoms becomes worse, they might even lose the ability to carry out a proper conversation or how to react to their environment. Patients diagnosed with Alzheimer's disease usually live like 4 to 8 years on average after they've been diagnosed, but they can live up to 20 years depending on other factors. What are the treatment for Alzheimer's disease? As I mentioned earlier, Alzheimer's is a progressive disease and we do not yet have the knowledge or the technology to cure Alzheimer's altogether. But we do have medications to treat the symptoms of Alzheimer's. This doesn't, as I said, reverse the progress of the disease or stop the progression of the disease altogether. What it does is it slows down the progression enough so that the patient can have more quality years in his life. But regardless, there are a lot of researches going on right now to actually find the cure for Alzheimer's disease. Before we get into the prevention of Alzheimer's disease, if you found this video to be valuable, if you learned anything at all from this video, the only thing I ask you to do is to share this video with your friends and family members. Spread the knowledge. If you haven't subscribed to our channel yet, go ahead and smash the subscribe button right there, and please do click the bell icon because YouTube's algorithm is changing all the time and we want to make sure our videos come and reach you. And until the next informative video, in anything you do, do your best and be the best version of yourself. And now to the prevention of Alzheimer's disease. There are a few conditions which increases the risk of getting Alzheimer's disease, and one of them is heart disease. Other factors are high blood pressure, high cholesterol, diabetes, a poor diet, and having a non-active lifestyle. All these increases the risk of getting Alzheimer's disease. So if you take care of all these, you have a higher chance, you have a better chance to prevent Alzheimer's disease. Besides Alzheimer's, managing your heart properly also helps prevent vascular dementia. Basically, a condition which occurs because the blood vessels have become so narrow that the blood supply to the brain is diminished. Another method of prevention is education. And this is from the National Institute of Aging. They came up with a statement saying the more education you have, the lower your risk is to get Alzheimer's disease. So you can always keep your brain active by learning new languages, taking new classes, or learning new musical instruments. Hope you enjoyed the video, and until the next informative video, bye bye.